Hello and welcome to another edition of Health Matters
and Health Focus.
I'm Anna Marie Sinatra, your executive coach, trainer, and consultant.
And I'm Ava San Marco, your practical nurse.
Very practical.
Very practical.
And together we are bringing you Focus on
Health Matters.
And we want to make sure that you get your pens and papers ready because we have lots of great information for you today. But before we get started, we want to thank our sponsors, one of which is Dr. Mascaro from Western New York Imaging Associates, where they have facilities all over Western New York and in Kenmore and Lockport and all over, helping you in your time of need when you need an imaging service.
And also Wings Flights of Hope with our friend Joe DeMarco, offering free medical flights to children and adults as well.
And adults. That's what's important. Everybody thinks it's just children.
Kids. Well, I didn't know that. I thought it was just kids
yeah,
too.
I know.
Yeah.
But we keep learning as we keep going. And we also want to thank our little Matty mattress from Mattress and More, where Matthew Sauer has been a. Are you doing Matty mattress on your sleep? She almost fell asleep at the last taping. Where he is educating us on so much information regarding mattress choices and when you have allergies and health issues regarding such. And there are quite a few, so I'm grateful that he's helping to educate you. And we really appreciate all your emails and your phone calls telling us how great we're doing. I don't think I've ever gotten any negative feedback, have you?
I haven't either.
No. So we appreciate that. And if you might want to be on the program as well, interviewed, give us a shout out on that too, and we'll consider that.
Okay. I'm very animated today.
I see that. I keep wondering, what is she doing on the side of me? I see all kinds of movement.
Well, you know, go ahead.
I'm excited today.
Yes, I am too.
Oh, that's why too, because I was giving you a hard time earlier. We were at Face Fitness.
Face Fitness.
Excuse me, we weren't at. I was there interviewing, and we did a wonderful program bringing you lots of great information. But Ava.
But Face Calisthenics or Face Fitness? No, it's Face Fitness.
Oh,
Sorry, I had to throw that in there. Calisthenics, 1, 2, 3, 4.
Well, it is because we learned so much. I know you watched the program because you were crying that you missed it.
Yes.
I'm glad you're here today.
Devastated, yes. But I am. I love doing these shows. I do.
Yeah.
Because a lot of times, too, we learn along with you, too. And they're very informative.
Absolutely. So would you like to introduce our guest?
Yes, I would. We have Michelle from Face Fitness. And we have Kathy from Face Fitness. You know what? I thought her name was Michelle, too. I don't know why.
Really?
You look like somebody I knew that was like Michelle. But anyway, and Kathy from Face Fitness, welcome to the show.
Thank you for having us.
And it's going to be a great show.
Thank you for coming, yes. Yes, we were talking in the green room about October being Breast Cancer Awareness Month. And we've had conversations with you, even when I was at your facility, when I was at your facility. All right, I'll let it go. When I was at your facility interviewing you both, I didn't even realize, that's why it's so great to have you back here in the studio. I didn't realize the extent of what you're doing in terms of cancer. And I know that you talk about the certifications you have, so let's hop in. And if you're a cancer survivor, you want to absolutely watch this program, or if you know someone as well, because they have lots of information to share.
I think where to start off would be that I think sooner or later someone is touched by cancer. If it is somebody you know, somebody in your family, or a personal experience. There are over 200 different types of cancers, and the most prevalent for women is breast cancer, followed by lung cancer and colorectal. In 2007, the concept in the spa industry was Oncology Esthetics, and my mentor and instructor, Maura Curran, wrote a book called Touch for Cancer, Oncology Esthetics. And what's wonderful about this is it's an actual certification class that people can take who are licensed professionals and learn how to work with cancer patients in a spa setting. A reprieve, a getaway, kind of alleviating stress and comfort treatments that are so desperately needed when someone is going through such a very stressful time in their life, as well as the caregivers going through that.
Because just the word cancer is just stressful, you know.
Oh my goodness,
For some people, yes.
There's a lot that goes with that word. My very first experience is when I embarked upon my profession. You know, I had a love for art and science, and I found combining art and science into aesthetics, skincare, cosmetology, and so forth was a beautiful way of me throwing things together. And a very high school friend of mine's father had come down with cancer. I had never known anybody that had had cancer or was dying from cancer, and it was a very interesting experience for me, where I learned that you don't have to do or say anything heroic, but just be there and support. And that was where I embarked
and to
upon
nurture
that.
people,
Exactly.
especially because they're very vulnerable at that time. And especially when you're first diagnosed, it is a devastating blow. No one likes to hear that sad news. Of course not. So
a lot of times people go through the disbelief. You know, why me? What did I do to deserve this?
Yeah.
There is a melting pot of emotions that are going on. Stress, a lot of stress. You know, it is a fight. That they're not sure it's going to be a battle that they're going to win or going to lose. So there's a lot of tests, a lot of MRIs, surgery, different things that people go through, chemo, radiation, almost to the point of where they begin to wonder if it's worth it, or you know, how the outcome is really truly going to be.
And your beautiful facility is like a little reprieve, that would be the best word to use, is a little reprieve to be able to come and take care of tell us some of the things that you actually do, besides, because we all know, like I'm very aware of the sometimes the sores and things that come out, as well as losing hair from the treatment.
Well, basically what aesthetic oncology is all about is really more dedicated to a comfort. A lot of cancer patients feel isolated. They feel basically that they can't be touched. So we're trained to work with the effects of chemotherapy and radiation, and there's a host of things that occur when someone is being treated. I mean, there's hand and foot syndromes, there's rashes, there is dryness, there's ulcers and sores and so forth. And there's a lot of, you know, uncomfortable experiences that one is going through.
And what kind of things do you do when they come to your facility to help alleviate that?
Well, first of all, they're non-invasive treatments, and it's really more or less to give them, we usually, the treatments are about 45 minutes, and it's just more of a comfort touch. We're trained to work with the side effects of the drugs around a port, and just more or less it's kind of giving them that stress release that they really need to just decompress, relax. So it could be just a gentle, very gentle facial. The massage is not a medical massage, it's more of a comfort touch. We usually will wait until we get approval from the doctor. When they are having chemo treatments, they're immune suppressed. So we have to wait for their blood counts to be up, and that we can effectively as well as gently give them a nurturing, it's more of a nurturing comfort experience.
But I can see you're working hand in hand with the medical piece of it too, by some of the things that you've said, which leads me to asking you about your certifications, because you have several different certifications. It's not like you're just figuring out how to work with someone who has cancer. You've actually been trained.
You're actually trained. You're trained in the sense of you're looking at more of the psychology, the emotional ramifications of what someone's going through. You know, a lot of times a cancer patient, when they've lost their hair, they're embarrassed. And they're constantly trying to hide or cover up. And when you have an esthetician who is in the comfort zone of dealing with this on a day-to-day basis, there's no surprises, you know. And I mean, we actually know that a lot of times when they've lost their hair, their scalp's very sensitive. So things like silk wraps around the head, them having the comfort of being able to come in and remove their wig and not feel like someone's looking at them strange or, geez, what's going on, or be like caught off guard. So it's kind of like, we know you have cancer, we're here to support you in your endeavor, we're here to help you through this, but most importantly, we are trained to work with the fact that you do have cancer and that your immunities may be suppressed. You may be very fatigued, you may be very tired, you may have achy joints, and there's a way of working with that safely, non-aggressively.
Well, that's good, because one of the things we learned in nursing school, one of the nursing things is you have an alteration in your body image, because every, you know, like the loss of hair and things like that. And I think that's excellent, because you're addressing those issues that are so important.
There's also, you know, cosmetic things that we do. Women will lose their eyebrows, and you know, we will be able to like pencil them in and you know, kind of show them how to bring those brows back. We even have, like, if they have stray hair left, we can tint their eyebrows to bring them back, and kind of just talk them through things like, you know, if they're having extensive dryness to their skin, some do's and don'ts, and how to, you know, look their personal best, which would be, you know, through camouflage therapy, kind of working with bringing their eyes out, trying to give them their identity back. Their face is their identity.
And let's bring in your partner here, because as she was sharing earlier in the green room too, you are a cancer survivor.
Yes, actually 10 years.
Wow.
Cancer-free.
Yes,
Thank you. I'm very
congratulations.
blessed.
So how has it changed from when you were diagnosed to what you guys have been doing for the last 5 years?
Well, 10 years ago, there was no resource to ask about your skincare or your hair. I had asked my oncologist, my doctor, and they were more concerned about saving my life than addressing my simple questions about my hair and my skin. Being a cancer survivor, today it allows me to have that common experience with my client. They know they can ask or say anything about their treatment and know that I come from the same place. Maybe not the same cancer, but the fear and the concern is all the same. And I think that brings a fresh perspective. I am a licensed esthetician, cosmetologist, and massage therapist, but oncology certification with aesthetics in the treatment room just allows me to really address that client's specific needs, to do no harm and to allow them to fight their fight.
Wow, that is so amazing. And I really get that too, because whenever we're going through anything as a human race, human beings, when we can talk to other people who've gone through it, like sometimes I have some parenting issues of parenting adult children or things with grandchildren or whatever, being a woman of a certain age. It's always helpful to talk to someone who's going through or has made it to the other side. And that's what they get when they talk to you. That's pretty amazing.
I think it's cancer was a blessing for me in that way, because then I can share that experience even within my own practice.
Wow. And you mentioned some of your certifications, because that's important. But what has you stand out is all your training to work with people who are going through medical challenges. Tell me more about the certifications.
I have over 30 years experience, and recently, a year ago, got certified in the Oncology Esthetics. It's a fairly new program. It began, the concept of it began in 2007. and Maureen Curran wrote Touch for Cancer in 2009 and instituted the certification courses. And I've been certified, it'll be a year in October.
Wow,
in
congratulations.
Commemorance of,
Breast Cancer Awareness Month.
I'm certified, I just recently got certified in the Aromatherapy Oncology, which is using aromatherapy with the cancer patient. And that was this past April. And so it's just using the science of aromatherapy and essential oils and how it can touch them as well as safely treat. We learned a lot about in aromatherapy, the flower part of it is to do with the soul and the emotions. And the leaves part was actually in regards to digestion. And the bark and the wood had a lot to do with the lung. Wow. And the actual, or the breath of life. And the roots is very grounding. So you can take a actual flower or an herb and break it apart, and it has medicinal needs for different parts of.
Just like ancient times.
Yes, very much so.
And you know what's so exciting is that doing this show and being very proactive in the holistic community, I'm very familiar with different remedies and different oils and their value. So it's so exciting to hear that, again, bringing Eastern and Western medicine together, that people may be going through these harsh treatments, which are important, and they can balance it off with some natural, holistic things to do.
Like complementing, yes, exactly. Complementary therapy.
And I actually think that this is what the Oncology Aesthetics is about. It's about bringing the Eastern and Western medicine together. It's really wonderful for a cancer patient to know that they can come to us with the fact that we are certified and they are going to be safe.
That's huge.
It's
Michelle.
huge.
Yes.
That's huge because
huge.
people today, and I'm just saying what the way it is that people will say that they're experts in many different areas and provide many different alternative or complementary treatments, but the certifications that you hold, that you're trained in this special area, it's exactly what you said, people can feel safe.
Right. It's an actual study that we embarked on, and in order for us to be certified, we have to pass an exam.
Well, that's important, yes.
We have to be examined as proof that the material given to us is something we've grasped and we've learned. We're on a national rectory. If people want to go to Touch for Cancer, they can go right to this directory, and they can scroll to New York State. And actually, it's I think we have about only four estheticians in the whole state of New York. My count may be off, but you know, it is new. It is fairly new. It's only been here a few years.
Wow.
And you're going to see more and more. I think eventually what I would love to see is estheticians certified in oncology and being able to work hand in hand in cancer institutes and really give the patient that simple dignity and that comfort. It's very important.
It is. It is very, very important. I know because my mom suffered from cancer and has passed from it, and I don't think this was around when she was going through, but how wonderful it would have been to be able to bring her to a spa somewhere where she knew that I could tell her ahead of time that people understood and survived cancer, and have a spa day together. Oh my goodness.
That would have been wonderful.
Mm-hmm. And then people want to feel secure too, safe and secure in the fact that they're being, taken care of, and they understand.
Well, they're on heightened alert, and every morsel of food they put in their mouth or any medication that they're taking, they're contemplating, okay, will this help, or will this hinder, or will it harm me? And I think the last thing on their mind would ever to come to a spa.
Exactly.
That would be the last thing they think that they could safely do.
Yep.
Like, you got to be kidding me. I'm going to do that? No.
I can tell you firsthand, too, whenever I tried to mention anything to my mother concerning complementary or alternative therapies, she would freak out because she knew I was into all that stuff, and she would say, no, 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 I got to ask my doctors, I can't. And I'd say, Mom, it's an herb or it's a plant, and she just, you know, they're scared. They're scared, especially if they're older, too. They're so used to just following your doctor and what they say.
It's ingrained in them.
And so now when you talk about having these certifications, we'll be able to say, I could imagine that I would be able to say, Mom, these people are certified in how to take care of you best. I know that that means a lot, and it should mean a lot to you when you're watching today. Those certifications are important.
And, you know, allegedly, of course, we would want any cancer patient to feel secure. And if they definitely would want to, you know, touch base with their doctor, we, of course, would want them to have that, you know, note of, yes, it's okay. And, you know, with our training and with our background, we can allegedly talk to a doctor and let them know that, yes, they would be safe because of our training and our background and our certification.
So you learn also about someone's hierarchy of needs.
Absolutely.
With the nutrition and the safety and the love and belonging. There you go. And that's how it plays in.
Right.
Because everybody, you know, has all those, you know, and the self-actualization and things like that. So that really addresses the whole
and people
thing,
are
the whole 9 rounds.
Exactly, exactly. And people are going to be kind of afraid. You know, I've seen it time and time again where they have survived and they've gone through all this chemo and radiation, and so they go completely either vegan or everything 100%.